Hi, my name is Ebony Sade, and I'm wearing purple for autoimmune hepatitis awareness. 2 months ago, I was diagnosed with autoimmune hepatitis after an 8-month-long workup. Autoimmune hepatitis is an inflammation of the liver that occurs when your immune system attacks your liver. The cause of autoimmune hepatitis is unknown, and it is not contagious, as that is the number one question that I keep getting. No, it is not contagious. But the disease is very rare and it's chronic. It affects 1 in every 100,000, which is less than 200,000 US cases per year. It commonly affects women more than men. Why is that? I don't know. Apparently women get it all, right? There are 2 different types of autoimmune hepatitis. Type 1 occurs in people of all ages, while type 2 typically affects children. The disease can only be diagnosed by a medical professional, but can be a difficult diagnosis, as many other diseases of the liver should be ruled out first, such as hepatitis A, hepatitis B, and hepatitis C. Especially when liver enzymes are elevated, you want to make sure that these are ruled out before you think of autoimmune hepatitis. If left untreated, cirrhosis and liver failure may occur. Not common, but if left untreated, some people, they may end up needing a liver transplant at some point during their life. Autoimmune hepatitis can be managed with immunosuppressant medications. No, they're not great medications, but they can be managed on these medications. Patients may present with mild to severe symptoms. In many cases, for myself, I didn't have any symptoms at all, but my liver enzymes were elevated for 6 months, which was my ALT and my AST, way above average. So they were like, what the hell is going on? Symptoms typically include, though, fatigue, abdominal pain, jaundice, which is yellowing of the skin. So you want to make sure to check your eyes, your fingernails, different things like that. Make sure they're not yellow. Dark colored urine, light colored stools. How they figured out that this was autoimmune hepatitis for myself was a liver biopsy, which is the gold standard, and autoimmune markers such as ANA, ASMA, and LKM. You can Google those, as well as immunoglobulin G, which is IgG, as well as complete liver function tests. After diagnosis is confirmed, it's best to start treatment as soon as possible so liver failure and fibrosis and cirrhosis doesn't occur. Typically, they put you on a prednisone taper, which is the first line of medication, and then the second line is Imuron, as however you pronounce it, which may slow or stop the progression of the attack on the liver. Both medications can have serious side effects and should be managed by a physician. I started on prednisone taper for about 2 weeks, and then I started on the Imuron, and I've been on that for about a month and a half now. And let me tell you, I've had the worst experience ever, nausea and vomiting in the last week, and it's not fun. I don't even want to take the medication anymore, but I know that I have to get better. Overall, my numbers have trended back down, which are in the normal range, which is good. So that means the medications are doing what they're supposed to do, and it is working. I have also changed my eating habits to I'm not eating red meat anymore. I don't eat pork, and I only eat chicken and seafood. Beef is hard to give up, though, guys. I will tell you that. People with autoimmune diseases should also look into the autoimmune protocol diet, which is the process of eliminating foods that cause inflammation and replacing them with healthy, promoting nutrient-dense foods that are thought to help heal the gut and ultimately reduce inflammation and symptoms of different autoimmune diseases. As we all know, there are a ton of autoimmune diseases out there. This just happens to be one of the very rare ones. The autoimmune protocol diet is similar to the paleo diet. You can actually Google it and look it up to figure out how to do it. It is difficult to follow. For many of my questions to be answered, it led me to join the Autoimmune Hepatitis Association, as well as I am in a support group on Facebook with other individuals who are also dealing with this very rare disease, autoimmune hepatitis. For more information, please feel free to follow me and DM me at @EbonySadeRN and subscribing to my YouTube channel, Sade Dior. I appreciate you guys. I thank you for listening. This is just something that I've been dealing with, and I wanted to share it with you guys. I hope you enjoy it.